Hello everybody, this is Dr. Ian Levinson again, Medical Director and Founder of the Colorado Center for Health and Longevity. Today I wanted to do a video on how you handle your mask, glasses, and gloves without contaminating yourself in the environment in which we live today with COVID-19. So the first thing you do, as per my other video with anything, is you make sure that your hands are clean. So the first thing you would do before you do anything is you would wash your hands, okay? Now your hands are clean, you can touch your mask or do whatever you need with your mask. So there are two types of masks. Actually, there are multiple types of masks, but I have two here. This is an N95 mask, and this is your more conventional hospital mask. The one thing about the conventional hospital mask is that you want to make sure that this surface is always clean, because that goes towards your face, that that it's pinched down, the metal is pinched down around your nose, and that this is covering your whole face and is very tight so that there's not much air leakage. Now when I go to the store, many times I see people like this. This does not cover you and is not a safe way to wear your mask. I hate to tell you, but you do breathe through your nose. So this needs to be up above your nose with the metal pinched in, and so that you have as little airflow as possible. Notice that I made sure that my hands are washed before I touch my mask. The same thing's going to be for when you take your mask off. I'm going to utilize it with this mask next. So first, wash my hands like I did. This mask has a peak where the nose piece goes. That goes on first so you don't contaminate the inside of your mask. And then you put the straps on. Okay? If you need to put glasses on or any other eye covering, they would go on next. And then you would go ahead and put your gloves on. Now when you go to the grocery store or wherever, also assume that these are just like your hands, that you clean them and wash them, you wash the card off. And then when you get back to your car, before you go into your car, you want to have some hand sanitizer. So your gloves are contaminated, they have glitter on them. So you don't want to go and grab your mask with glitter on your hands. You want to sanitize your hands before you touch your mask or your glasses. So you want to go on the inside of the glove here and pull the glove inside out so the contaminated portion is on the inside. Same way with this, gloves go inside out. Now, before you touch your mask, you need to wash your hands again because they're not completely sterile and you don't want to contaminate your mask or your glasses. You bring your glasses off. You take your mask off the same way it came on, and you make sure that you don't contaminate the inside of that mask. So therefore you can reuse this because neither of these masks are contaminated. These should go into the wastebasket, and they're now not reusable. So they're only used once. So that's the general technique to keep yourself safe and to be able to reuse your mask and not contaminate yourself. Of course, when you have your mask on, you still shouldn't touch your face, but you still have coverage or protection if you forget, and that's one of the biggest advantages of the mask. The only other thing I want to say here is there's some data that's coming out about protecting you from coronavirus with high-dose vitamin C and zinc. There are no official regulations or recommendations. However, many people have found that 1,000 milligrams of vitamin C and 100 milligrams of zinc have been somewhat protective for COVID-19 or coronavirus. Thank you for watching. We are here for you. We are available. Our phones are being answered Monday through Friday. We want you to stay safe. Be careful, and God bless you. Take care. Thank you.